My name is Elizabeth Hertko. The title of my presentation today is A Comparison of the Vulnerability in Diabetic Populations in the United States. In this presentation, I will be comparing different diabetic populations in relation to their prevalence and access to healthcare. To start off, I'd like to take a moment to discuss a breakdown of the prevalence of diabetes in the United States. Diabetes is relevant to our society today because it is the sixth leading cause of deaths. This is a great infographic that breaks down the diabetic population according to certain factors. For ethnicity and race, the estimated U.S. national prevalence of diabetes is 11.4% for white, 18.3% for black, 16.7% for Hispanics, and 11.1% for others. About 13.3% of the U.S. is an insured diabetic, meaning they have insurance, while about 9.2% of the U.S. population is a diabetic without insurance. More and more people are being hospitalized for diabetes, and the estimated direct cost of diabetes in 2007 was $116 billion. Now, I'd like to focus a little bit more on the breakdown of diabetes in relation to race and ethnicity. According to this chart taken from a research study, more minorities had diabetes in comparison to non-Hispanic whites in the population studied in this research from 2010 to 2012. Our textbook states that the available evidence suggests that minorities generally have poorer access to health care, receive poorer quality of care, and experience worse health outcomes. I'll be discussing access and health outcomes in relation to diabetes more a little later in the presentation. The book also states that ethnic minorities are also more likely to lack health insurance, which will also be touched on in this presentation. Another research study focused on the racial and ethnic differences in healthcare access and health outcomes for adults with type 2 diabetes. The data indicated that although all three race and ethnic groups face suboptimal health status, there are some differences among Caucasians, African Americans, and Mexican Americans in healthcare access, utilization, status, and outcome. In this table from a study, a couple of details stood out to me. The minority groups are less likely to self-monitor their blood glucose levels at least once a day in both the insulin and non-insulin treated patients. For insulin-treated patients, 44% of the Caucasian population checked levels daily, while the percentages were about 26 and 27% for African and Mexican Americans. The minority groups are also less likely to have public or private health insurance under the age of 65. After looking at minority-specific details concerning diabetes, I wanted to look a little more into the relationship between healthcare access and undetected diabetes. A study found that undetected diabetes was related to insurance coverage, routine patterns of healthcare utilization, along with continuous coverage. The number of doctor visits and type of insurance also had a relationship with undetected diabetes. This study also found that people without insurance, or those insured for less than a year, were significantly more likely to have undiagnosed diabetes. Although race and ethnicity is related to diabetes and poor access to care, this particular study showed no evidence that race and ethnicity affects the relationship between access to healthcare and diabetes detection. The study found that individuals of lower socioeconomic status and those without insurance were at greater risk for not receiving preventative care regardless of race. Another minority in relation to diabetes would be women with gestational diabetes mellitus. In a nationally representative population-based survey of women with gestational diabetes, the study found a significant lack of access, services, and overall health among all races and ethnicities. About 20% of the population at risk for gestational diabetes reported no insurance, cost barriers, and/or no primary doctor. Over 25% hadn't had a physical examination in the past year, which directly results in a lack of preventative measures and screening for gestational diabetes. This data goes along with not only minorities with diabetes, but also lack of diabetes detection. Overall, I found that minorities with diabetes, whether it be race, ethnicity, gender, or socioeconomic class, have a lack of access to care, including self-monitoring techniques. I believe all diabetic populations could benefit from having health insurance, diabetes detection, and overall improved access. Now it's time to hear a little bit of your input. My first discussion question is, What do you think would be the best ways to encourage Americans with diabetes to self-monitor their blood glucose levels every day? My second question is, do you think it would be beneficial for Americans to receive blood tests to determine the presence of prediabetes and/or diabetes as part of a routine physical and/or at a certain age in the United States? Why or why not? Thanks, guys. Have a great day.